is Susan Matthews, and this is Leah Carlisle, my patient. Today we will be performing a physical assessment of just the first half: general appearance, skin, HENT, cardio, and pulmonary assessment. Okay? Hi Leah, my name's Susan. I'm your nurse who's going to be performing your physical assessment.
Okay.
Can you please tell me your first and last name?
Leah Carlisle,
And your birthday?
5/17/91.
Okay, and can you tell me where we are today?
We are in my apartment.
Okay, and can you tell me who the president is?
Mr. Obama.
Okay, so far Leah is alert and oriented. Neurologically, she's intact, and general appearance, there is no body odor for Leah, and her skin is pink, warm, and dry. Just by looking at her, I can tell that her face is symmetrical. Let's see, I don't see any scarring or lesions. Do you have any tattoos?
I do.
You do? Any trouble healing from the tattoos? Okay. Any body piercings?
Just my ears.
Okay. And no trouble healing from that? Okay. Visibly, I don't notice any pressure ulcers as well, which for some patients, a more thorough skin assessment would be needed to check for pressure ulcers. Let's see here. Okay, let's move on to head. Speech. Leah's speech is also clear, not slurred, and like I said, her head is symmetrical. I don't notice any facial drooping or problems speaking. Ears, I do not see any drainage. I will check. I'm sorry. Any problems hearing?
Mm-mm.
And I also can tell that there's no problems hearing because she can answer my questions and hear me. Let's see. Eyes. We're going to check for Perla. Leah, if you could look at my nose, I'm going to shine a light in your eye. Okay, and we will check for accommodation. Leah, can you please look at the wall ahead of you and back at my pen lights? Very good. Okay. Let's see. Do you have any trouble seeing? Any vision problems? Blurred vision, double vision?
No, I just wear reading glasses to keep the eye strain.
Okay. So I would note that she would need corrective lenses when she reads. Can you open your mouth for me? Say ah.
Ah.
Okay. Her mouth is moist, pink and moist, and I would also note that her tonsils from her health history were removed in what year was that?
2006 or 7.
Okay. So I would note that she has no tonsils also. Let's see. Nose. I don't notice any nasal flaring or drainage. Do you feel short of breath at all?
Mm-mm.
Okay, I also don't see any shortness of breath symptoms. She rises symmetrically. And let's see. Throat. I'm going to check to see that your trachea is midline. Can you swallow for me? Okay. No abnormalities there. Okay, so I'm going to go ahead and take a listen now that I've looked. I'm going to take a listen to, we'll do cardiac first on all the landmarks: aortic, aortic, pulmonic, tricuspid, then mitral valve. Okay? Okay, lung sounds. I'm sorry. Heart sounds are regular and strong. I don't notice any abnormalities there. We're listening for S1 and S2, so she would present normal there. So let's go ahead and move to lung sounds. We're going to do first posterior, then anterior. Posteriorly, we'll be listening on both the right and left and comparing sounds, listening for any wheezing, crackles, anything there. Okay, lung sounds are clear bilaterally, so I will move to the posterior side and do the same, comparing both the right and left. Deep breath. Okay, lung sounds are clear bilaterally as well. Thank you, Leah. That was the first half of our physical assessment.